So next speaker is Dr. Shweta. Is she there? Yeah, please. She is also going to speak on MIGS, outcomes of bang versus absolute goniotomy with cataract surgery in POAG.
Good morning. I'm Dr. Shweta Ranjiv. I'm honored to be here to talk about the culmination of my research, which is on the topic outcomes of bent ab interno needle goniectomy and Espilat JCS goniotomy with phacoemulsification in open angle glaucoma. As we are well aware, the traditional landscape of glaucoma management has dramatically changed over the last decade, from the conventional trabeculectomy to minimally invasive glaucoma surgery, mainly for the mild to moderate cases of glaucoma. MIGS is a revolutionary new approach with a good safety profile, ab interno technique with minimal tissue damage. So my study is been done in the Department of Glaucoma, Arvind Eye Hospital, Tirunelveli. 23 eyes were taken in both the groups. It is a prospective interventional study. It was followed up for a period of 6 months. So the inclusion criteria involved patients of 40 to 70 years, mainly diagnosed with primary and secondary open angle glaucoma, with a pre-op intraocular pressure of more than 21 mmHg, with a mean deviation of less than 12 decibels were taken. Some of the pivotal studies which were done previously, done by Ms. Maheshwari et al., is the comparison of microhook trabeculotomy with phacoemulsification or phacoemulsification alone in patients with mild to moderate open angle glaucoma. In this study, the microhook trabeculotomy with phacoemulsification group had a higher mean fall of intraocular pressure with a higher fall of reduction of need of AGMs from 0.6 to 0.2. Another important study was done by Shebani et al., mainly on the outcomes of bent ab interno needle goniectomy with phacoemulsification or phacoemulsification alone. Again, showed a 73% success with reduction of intraocular pressure as well as a fall in AGM use. Gilman et al. Also was another study which has done meta-analysis on the various MIGS techniques. As we know, BANG is being performed all over India. Espilat JCS goniotomy is a novel new technique developed by Dr. Alexandro Espilat in December 2022. It has no antecedent studies done in India. There are only few studies which compares different types of MIGS techniques. So bent ab interno needle goniectomy, after a standard phacoemulsification, the 25 gauge needle is taken, which is bent at the tip, and it is used to excise the nasal 60 degrees of the trabecular meshwork. Espilat JCS goniotom. This is a special new instrument with which has a V-shaped tip. The distal end is used to make a trapdoor entry into the trabecular meshwork, while the proximal end is a shelving, less sharp, blunt tip, which is used to delicately press and bulldoze the trabecular meshwork without causing much of trauma to the trabecular meshwork and opening the Schlemm's canal. So a success criteria was assessed by checking the fall in intraocular pressure, the reduction of AGM use, and best corrected visual acuity also was checked. Complete success was classified when an intraocular pressure of between 6 to 15 mmHg or a more than 25% decrease of reduction from the baseline without a need for AGM use from baseline. Qualified is with additional anti-glaucoma medications, and failure is inability to meet the criteria in 2 consecutive follow-ups. This was my demographic data. There was significant reduction in the intraocular pressure and AGM at the end of 6 months. The average number of AGMs dropped from 0.3 to 1.7 in case of BANG, and from 0.13 to 0 at the follow-up of 6 months. And there was a higher mean percentage of intraocular pressure reduction in the Espilat group as compared to the BANG group. Comparing the AGM between the 2 groups, there was a steady decline of AGM use at each post-op visit, which is at day 1, week 2, 1, 3, and 6 months. And there was a statistically significant decrease in AGM at the month of 6. Best corrected visual acuity also decreased between the groups at each post-operative visit. However, there was no statistical significance between the groups. A complete success of 100% was achieved in 1 month. At 3 months, 85.7%, and 95.2% was achieved 85 in bank group, SPLAT group 95%, and in month 6, 81% of complete success in bank and 85% in SPLAT group. Kaplan-Meier chart survival plot was done, and both the groups were almost the same. Complications, there were, however, a higher complication rate was observed in bank group with 3 cases with iritis and microhyphema, 4 cases of microhyphema in bank, but in SPLAT there was just 1 case with microhyphema, all were managed conservatively. So basically both the groups had equivocal response with reduction of intraocular pressure. The AGM load significantly reduced in the SPLAT group as compared to the bank group. It is a less dramatic way of an MIGS technique when compared to a bent ab interno needle goniectomy. So both of these procedures can be used
Your
in
time's
case
up. Sorry.
of mild to
Wrap up
moderate.
quickly. Yeah.
Thank you. Thank you. I would like to thank my my consultants and the entire department of glaucoma, Tirunelveli.
Was there a selection bias? Which cases did you choose for Bang and which for Espilat?
Ma'am, so there was no randomization done. So that was one of my limitations of the study. We had just selected patients, 23 patients in either group with mild to moderate glaucoma, open angle.
In one of the groups, the number of AGM was 0.13.
Yes, yes.
Less than 1.
Less.
So why did you do surgery for that patient, for those patients? 0.13 means some of them were not even on medication.
Yes, ma'am. But they had a mean deviation of less than 12, minus 12. Mild to moderate.